Welcome back for part 2 of our physiology series. We're going to give you an overview of the circulatory system. If you don't already subscribe to our channel, now's a great time to do that. You can click the button over here, subscribe to the channel, and then make sure your alerts are on so you're alerted of any future videos we post. Also, if you have any questions or comments, leave those below. We'd love to hear from you. And give us a like on this video if you find it helpful. In part 1, we talked about our blood being like a railway with train cars that transport oxygen from the ambient air down to the cells that need them. So our cells need things like oxygen and glucose, and actually a bunch of other things as well, to be able to continue to operate. And when we say operate, we mean produce energy. That energy allows us to live. So we have cells in all our different organs and all throughout our body, and they need these oxygen and glucose molecules to continue to thrive and produce energy. And then that energy we represent it as a fire. That fire gives off a smoke, carbon dioxide. It gets transported back through the rail system, back out, and is expelled through exhalation. Well, let's take a deeper look now into the circulatory system, which is the blood vessels and the blood and the heart and everything that makes this blood go around the body to distribute all these things to the right places. So in our circulatory system, we have 3 different components of that system that we're going to take a look at. Those 3 things being the fluid, the container, and the pump. So this fluid we're talking about is obviously blood. The blood is the railway or the transport system for the body. It moves things from one location to another and then goes through things like kidneys and liver to filter out bad things, get rid of them so it can go right back into the system, pick up more stuff, and it's a pretty incredible system. So we have about 5 to 6 liters of blood in an adult body. A child's going to have 2 to 3 liters depending on their size, infant even less than that. But let's talk about an adult specifically, 5 to 6 liters of blood. Now, the heart can pump about 5 to 6 liters of blood through the heart in 1 minute. So in 60 seconds, most of the blood in your body makes its way back through the heart. So that's an important fact to keep in mind when we're talking about how fast someone can bleed out. When all of the blood goes through the heart in 1 minute, it doesn't take long for someone to bleed out from an arterial bleed. So all your organs need blood because blood is the transporter of life. It brings all these things to these cells. All your organs need this to stay alive. At any given time, each one of your organs has a specific amount of blood in the body. So it's kind of broken down like this. Your skin has about 5% of the blood volume in it. Your heart has about 5%, your brain about 15%, your kidneys and your renal system have about 20%. Your skeletal muscles, which allow you to move and pick things up and walk around, is about 20%, and then your GI tract is actually about 25%. And then there's other various organs and things in your body that need blood as well that have some blood associated with them as well. But those are kind of some of the big organs that actually need blood, and that shows you how it's kind of divided up between those organs. So the second thing that we have in the circulatory system is the container or the pipes. The pipes are our veins, arteries, basically all our blood vessels combined. And if you took all your arteries and veins and capillaries and all these things and stretched them all out, they'd be about 60,000 miles long. And about 80% of that are capillaries. Now the capillaries are the real small vessels that live right in between the arteries and the veins. So as the blood comes from the artery and it comes up to the cells that it needs to perfuse, it goes through these small little capillaries. Those small little capillaries allow the blood to slow way down, allows a gas exchange, and allows some of these nutrients and gases to move into the cells. And then that blood comes back around the other side to the venules, the veins, the vena cava, and back to the heart. So these capillaries are actually where the transfer of gases and nutrients back and forth to the cells actually takes place. So the third component and the last component we're going to talk about here is the pump, which is, of course, the heart. So the heart is actually what pumps everything through this system. So we get a rough heartbeat of 60 to 100 beats per minute in an average adult. And so we are now pumping basically the entirety of blood in the body through the body in about 60 seconds with the pump from the heart. So now we're going to take a look at these 3 components and figure out what can affect increases in heart rate increases in blood pressure, and how all these things actually work together to continue to provide blood and oxygen and all these nutrients to your body. Let's stop for a minute and talk about blood pressure though. So blood pressure is one of our vital signs. It's something that we take on patients, we use that to determine treatment, and we base a lot of our protocols of treatment and what we do for these patients based off of a blood pressure. But what is it, what does it mean, and how does it affect all these other things, and how is it affected by some of these other things such as heart rate? So blood pressure is the pressure in your arteries. So remember, as our blood leaves our heart, it goes through the arteries, then arterioles, which are just smaller arteries. Then it goes to the capillaries, and that's where the gas exchange takes place. And then it goes into venules and veins and back to the heart again to get cycled back through the lungs to pick up more fresh oxygen and back through. Well, when we're taking a blood pressure, we're taking the pressure of the fluid inside the pipes on the artery side. So we're going past the heart, down through the arteries, and we're going to put a blood pressure cuff on the person's arm, and we're going to squeeze it to be able to get two different numbers, a systolic pressure and a diastolic pressure. And here's what we're getting when we get those pressures. So as blood is moving through the arteries, there is a natural pressure that is there that is pushing on the walls of these arteries when the blood is at rest. As soon as the heart pumps and squeezes, it's going to propel blood through that system. It's going to increase the pressure for a second, and then as soon as the heart relaxes and starts to refill with blood, that pressure is going to come back down kind of to its baseline. Well, those are our two pressures. When it pumps and spikes, the top part of that pressure, the highest pressure we reach when that heart contracts, is called our systolic pressure. So when we're listening to blood pressure and we write two numbers, the top one is our systolic pressure, and let's use 120 over 80 as a normal right now. So 120 is going to be our systolic pressure. Heart pumps, blood pressure spikes, it goes up to 120, and we document that as our top number. 120 is our systolic pressure. Then the heart relaxes for a minute. And when it relaxes, it refills with blood, gets ready to pump again, and all those pressures in our arteries slowly come back down, and now they're sitting at this base level. That base level is our 80. So our 80 is kind of our base pressure in the body. The 120 is the spike it gets to every time the heart pumps, and we go 120, 80, 120, 80, all the time in between each beat of the heart. And so we write that as 120 over 80, so now we know what the peak pressure is and what the base operating pressure is for our blood system. Let's look at an equation real quick to show you what blood pressure is. And as we look at other things that affect the blood pressure, it'll kind of make sense on why it affects the blood pressure. I know it looks like math, but bear with me for a minute. It's not actually that complicated. So blood pressure is cardiac output, how much blood comes out of the heart in 1 minute, times vascular resistance, the resistance that's in the pipes. So if the pipes are smaller, there's more resistance. If they're larger, there's less resistance. So whatever the resistance is, times however much blood comes out of the heart in 1 minute. That is what our blood pressure is. So if we have less blood coming out of the heart in a minute, but the resistance is the same, our blood pressure is going to go down. But if all of a sudden we have more blood going through the same size container or the same size pipes, now we're going to have increased blood pressure to be able to get that same amount or that increased amount of blood through the same size pipes. So there's a direct correlation between the cardiac output in a minute, how much blood goes through the heart, and the vascular resistance in the pipes themselves. So there are several different things that affect what raises or lowers our blood pressure. So let's talk about raising our blood pressure first. What can affect our body that causes our blood pressure to increase? Well, so we've got our container, which are our pipes, which hold all this fluid, our blood. So these vessels are our container. If that container changes in diameter, that could increase or decrease the pressure. So let's say now our container or our pipes get bigger. As they get bigger, there's more voids in there and there's less pressure from the fluid that was in there before. So if all my arteries were to slightly get a little bit bigger or smaller, that's going to change the pressure. That's going to decrease or increase the pressure based on how much those arteries are squeezing around that fluid that's inside there. As a visual illustration, let's take this garden hose for a minute. So we have a certain amount of blood or water flowing through our vessels. It's not a very high pressure. There's plenty of flow, but there's not high pressure. Well, now as we start to occlude this end, we don't increase our flow, but we're increasing the pressure, especially the back pressure behind this point of occlusion. So if we have any sort of plaque buildup or any sort of constriction of this area of the vessel, we're not really going to have a increase of flow, but we get the increase of pressure. So the volume moving may stay the same or may decrease, but we're gonna have an increased pressure buildup, which is correlating to a blood pressure. So let's look at a couple things that can raise your blood pressure. If you have an adrenaline rush, that releases a bunch of epinephrine in your system. It causes all your vessels and your arteries to constrict, and that will increase your blood pressure. Another thing is plaque in your blood system that starts sticking to the artery walls. So if plaque from high cholesterol or fats in your blood start sticking to artery walls, it starts narrowing that passage that the blood has to go through. And it's essentially the same as putting your finger on the end of a garden hose. So it starts to narrow that passageway for the blood, and then pressure starts to build up behind that. And so you see an increased blood pressure behind that point of the plaque buildup. Another thing that can increase blood pressure is actually having more vessels to have to push this blood through. The more vessels means more resistance. It's having to push it through a bigger system now. So if we increase that 60,000 miles of vessels to something even larger, we're going to have an increased blood pressure as we have more resistance now. Well, how can we make our vessels longer? Well, obesity will actually do that. So the bigger the person is, the more vessels and blood there is now in the system. So there's actually gonna be an increased resistance there because there's more vessels now. So if you have more vessels, it's gonna be an increased blood pressure. Increased blood pressure is bad for your health. It wears out a bunch of systems prematurely. It's not good for your health. So not only is plaque bad, but the actual obesity itself causes more vessels to be formed, and that will increase your blood pressure. So another thing that can raise your blood pressure is obviously an increased heart rate. So again, an adrenaline rush that increases your heart rate. If you have a bunch of caffeine, energy drinks, that kind of thing, that will increase your heart rate, and that can increase your blood pressure as well. So if you start messing with these three main components of the circulatory system, you're going to have effects from that. So if you change the container size, if you change the fluid, the viscosity of the blood, that will affect some of the resistance and the pressure. If you affect the heart, make the heart pump faster or slower, that has a direct effect on it. So these energy drinks and caffeine that, or anything really that increases heart rate, will increase that blood pressure to some extent. So what can lower your blood pressure? Well, hypovolemia means low volume. So that means we don't have as much blood in our system. So if we have a decrease of fluid, that can mean a low blood pressure. How do we have a decrease of fluid? Well, dehydration or somebody bleeding out, blood loss. So these can affect the body to have a decrease in blood pressure. So the body will initially compensate for these things, but in the long run, you're gonna have a decrease of blood pressure from blood loss. So we can have a decreased blood pressure if we have a container problem. So if our container, our pipes, our blood vessels get bigger, our container gets bigger, our blood pressure will drop because there's not as much resistance in that container or in those pipes to keep that pressure up. So if we have something that causes those vessels to relax and open up, like anaphylaxis. If someone gets stung by a bee, the natural response of the body is to dilate the blood vessels. You have a drop in blood pressure, and that's a container problem. Now the container is not the same size it was. It actually increases in size because those muscles relax, and now you have a drop in blood pressure from that. So the container size affects blood pressure. One other thing that can affect blood pressure is also a pump problem. So the pump is the heart. So if you have a heart attack, obviously a cardiac arrest, if the pump stops completely, that's an issue. But any sort of injury to the heart can now affect the blood pressure because the pump is what's driving that pressure. And if you have an issue with that pump to where it's not pumping as fast or as efficiently or as hard as it was before, that's obviously going to lead to a drop in blood pressure as well. So as we wrap this up, keep in mind we have a circulatory system which has three main components: the container or the pipes, the fluid that is in that container, and then the pump that circulates that fluid through the pipes or that container. Anytime we affect or we change one aspect of those three components, it's going to affect those other components in that system. If we have a decrease in volume, decrease in fluid, the body will naturally close that container up, tighten that container, constrict those vessels, It will also increase the heart rate to compensate for the issue with the decreased volume. So there are a lot of different mechanisms that God put in our body to compensate when there's an issue with one of these 3 components in the circulatory system. So we'll dive more into that in our next video in part 3. Part 3, we're going to be talking about shock and compensation. We'll go through the different types of shock, how that affects the body, and what that means to you as someone that's providing care for some of these people. So stay tuned for the next one. Part 3 will be shock and compensation.